And get started. That's official. The recording is in progress. Okay, so welcome everybody. We are so happy that you are here today. You are here at Senior Roundtable, and I'm going to introduce myself, et cetera, in just a second. But what's happening is because we're hybrid, we have a speaker up here for the folks that are on Zoom so they can hear everything that's going on. He's got a camera also pointed on here, so if you're on Zoom, you get to see exactly what these folks are looking at here. So if you are speaking, you'll have several opportunities to do that if you want to during the meeting. We'll ask for you physically to come here so the speaker picks you up. So my challenge is I'm going to still turn around, look to see, to make sure I'm talking about what I think I'm talking about. So you'll have to just be honest if I'm moving off camera. So my name is Laura Steigelman. I am a facilitator. I have had the complete honor and privilege of being the Senior Roundtable facilitator for over 16 years, which is how old this group is. We meet 6 times a year. We are funded and founded by the Community Foundation. Let me get there and then we'll come back. Hang on. We're founded by the Community Foundation, and they realized just a few years ago that people in the senior sector didn't necessarily know who else was doing what that could have helped their clients. And probably the more obvious example is somebody who needs a wheelchair, but that organization and nonprofit, et cetera, does not do that, but down the street they do, but they didn't have an opportunity to know of each other. So Community Foundation started this. They still support us today. And we got good news. I haven't even had a chance to tell the advisory committee this yet, but it looks like 2026 is also going to be moving forward. So hopefully we'll see you all again, but the meetings are free. Twice a year we try to have in person, simply just from a networking standpoint and getting people out of the house that are looking for an opportunity to get out of the house. And then the other 4 meetings are via Zoom, and again, open to anybody who is interested. You don't have to be, I only work at a nonprofit that works with elders. It can be anybody who has an interest is always welcome to join us. So with that, you'll see for some of the video folks, so I'm gonna stand right here. So if you are on Zoom, these instructions and requests are for you. That if you're able to keep your video on, great. So those on Zoom with you get a chance to actually have some human interaction. There is a chat box that Herb, who is your Zoom producer, and this is Herb, by the way, for everybody in the room. There's a chat box that Herb will be using for instructions, directions, and you can ask questions and things like that there. There's a mute button if you're not actually speaking intentionally to Herb or the room. If you'll please keep yourself on mute. And then if you'll have your name underneath your video, Herb will manage that for you if you need to. And today's meeting will be recorded for anybody who wants to come back and take a look at it or forward this topic to someone else from our awesome speaker, Emily, which you'll hear about in just a bit. Everybody, it's your first Senior Roundtable meeting. Love that, love that. So again, Gabby here is the email distribution person. So if you would like to get on the email list to get future meeting notices, usually it's a January meeting is what we kick off for 2026. She manages that, and we don't use it for anything other than Senior Roundtable. The only thing we use it for is you will get notices that a meeting's coming up, and if you want to RSVP, here's how to do so. Otherwise, we don't sell it, we don't junk it. Being told to move back. I'm a mover. This is going to be quite challenging. All right, so welcome for anybody who is new to the group, and here is our agenda for today. What is Senior Roundtable? I'll talk a little bit more about that. Our meeting sponsor, Tanya, wherever you are, there back there, is going to be speaking here shortly as our meeting sponsor for today. You'll have an opportunity if you have a senior sector announcement that you think would benefit everyone else to know about. Maybe you've got a senior prom coming up, or a fishing tournament, or a 5K to support Alzheimer's, something like that. We'll ask at that time if you'll come up to this magical spot, apparently right here, and share that with us at that time. We'll give you a heads up of that. You'll have a networking opportunity to meet others in the room. You can see what our program is, and our speaker, again, Emily, hiding over here in the corner. And then we will wrap up and get you out the door. So with that, and I don't know why, again, it's the logos are being blocked from that laptop, but know that should be the Community Foundation up there. For some reason with the flash drive, that laptop does not like the marks that are there. So Community Foundation is the logo that would be there, and it should be there, and is actually there, but for some reason the laptop's not allowing it to come out. As I mentioned, they started this, and they are still the supporter. Janet Ellen, if you haven't ever had a chance to meet Janet Ellen, she's usually at all of these meetings, but she is our kind of our contact with the Community Foundation. We work closely with her, roll things out, and keep things moving ahead. And ElderSource, I never give enough credit to ElderSource. They manage that email list, as I mentioned, Gabby right here. So if you haven't met Gabby, be sure to do so. They also allow us to use their space, which we appreciate. And they're always so helpful on what's a good program to have, who should we invite in to speak, all those kinds of things. So what is Senior Roundtable? It's a coalition of anybody who is interested in the senior sector. So as I mentioned, everybody welcome. We're so happy that you're here, make those connections, and that we get to know what you do and what you're doing out there. I think I mentioned all of those. Networking and the program focus is the purpose of these meetings. So we always try to have a good program for you that we think would be beneficial to anybody who's attending, and also an opportunity to network. So whenever we've done a survey of those attending Senior Roundtable, we said, why do you come and what's important? Networking is always number one, and important program information of whatever the topic is the second one. So we always try to keep those two things going and moving forward. And you can see what the mission statement is there. So this group here, if you were in the room, please raise your hand. This group here is the one behind the scenes that I bug all the time to say, I say, so let's plan January's meeting. What's the topic that we haven't done or it needs attention, et cetera? There you go. What is the topic that we should do that would be valuable, and who do we know as a resource? And they reach out, they find the folks, we get the whole thing set up behind the scenes. And with that, Gabby, as an official welcome from the Senior Roundtable Advisory Committee, please introduce yourself.
Hi, everybody. I'm Gabby. You haven't met me yet. I am a specialist here at ElderSource. So I've been working with the Senior Roundtable for 3 years. Just like she said, it's basically a meeting of the minds. So if anybody's ever interested in joining us, please join the advisory. I'd like to talk. We kind of just reach out into our networks and start pulling people. So I will say it's been great, because one of my favorite things about it is that I have friends how I know, like, someone's like, oh, I need help with this. I'm like, I know somebody. So that's one of the best parts about being involved in the Senior Roundtable. And just in case you haven't heard about ElderSource before, we are the area agency on aging for Northeast Florida. We support older adults, caregivers, and adults with disabilities. We have a helpline. We get over 5,000 calls a month. Do quite a bit. And speaking to Emily, it's open enrollment, so she'll be speaking about what our SHINE program does. And I have to say this, if there's a fire out these doors, there's a stairwell. And that's all I can. Nice to meet everybody.
Okay, Gabby, thank you, and thank you for the welcome. Okay, so this group here behind the scenes, we appreciate everything that they do. So how do you stay connected with each other when you're not in this room or on the Zoom calls with us? There's several ways that you can do that. I've already mentioned that Gabby has the email list. You can sign up with Gabby, and if you can't get that quick enough, just talk to her before you leave here today. We have a LinkedIn group that specifically is for Northeast Florida Senior Roundtable, which is what this group is. You can also join there as well. And then we have 3 years COVID time worth of meetings, and we record all of these, including today. That if you wanted to go back, we had a great one. All of them. I got to just say, every time we have a meeting, I'm like, man, that speaker was great, and those organizations are awesome. We have a whole list of different things: medical marijuana, understanding Medicaid, downsizing as a senior, just anything you can think of. This group has pulled together, and they've got all of those on the YouTube channel. So that's another opportunity. If you want to go back and look at a meeting, or you thought a meeting was good and you said, man, I wish this person could have been there, you can let them know about it. Today's breakfast sponsor for each meeting, we always have a sponsor. If it is a Zoom meeting, they give a couple gift cards that we do a random drawing at the end of the meeting. So when it's in person, they sponsor this awesome breakfast. So you have the floor, and if you're willing to come up, so the camera gets you in, they can hear your awesome 3-minute speech that you're going to do. And please be willing to introduce yourself, tell us about AHEC, and anything else we'd like to say.
Thank you.
Please be careful.
Yeah.
There you go.
Thank you so much, Laura. Good morning, everybody. My name is Tonya Harris, and I'm the Executive Director at Northeast Florida AHEC. And so if you've never heard of AHEC before, we are the Area Health Education Center. So we go out into the communities and we do health education programs. Today I have with me Jennifer Smith. She is our Senior Program Manager. And for our seniors in our 7 counties, so we serve from Baker County all the way down to Volusia County. Our programs are at no cost. You will find a pamphlet in front of you, and for those of you online, I'll just go ahead and read it out. So some of our programs are, we do the Matter of Balance program, we do Tai Chi for arthritis, we do SAIL program, which stands for Staying Active and Independent for Life. We have a healthy eating everyday program. We have 2 diabetes programs. We have chronic disease, chronic pain. So Northeast Florida AHEC, we are your resource for your seniors, for your older adults. Our programs are at no cost. You can contact us to schedule a program. We come in, we bring all the materials, we bring all the supplies. Our programs are evidence-based, so they are proven effective. And we've been working in our 7 counties since 1993. So we've been around for a long time, and we've been doing this work for a long time. One last thing I'm going to add, most recently, we have been asked by the state to be the Cancer Control Collaborative for the Northeast region. So under this umbrella, we are going to be doing a cancer evidence-based program. It's called Cancer Thriving and Surviving for cancer survivors and caregivers. So that's something new that we are going to be rolling out starting in February of next year. But if you serve seniors and you're looking for activities to bring in to your center, you can reach out to us. Jennifer's going to leave her card. We come in. Again, it's at no cost to you. We provide everything, and we've been doing this work for quite a while. So I think my this might be cool. Okay, so each person got a pen. This is what we give out, and a magnifying glass. And Jen is gonna leave her card. We also have an opportunity where we train facilitators. So we are getting ready to train a new batch of facilitators in January. And so we train the trainer. So we train and certify individuals to go out in the community and facilitate these programs. So we also have flyers for that as well. Thank you. Thank you, guys.
Awesome. Round of applause, please, for Thank you. And at any time, if you need to refresh a coffee or if there's a croissant in there that's still sitting there that's calling your name, please feel free to get up and take care of yourself there. Okay. If you have a senior focused announcement, come on up and we'll just, if there's several people, we'll just form a line. We'll try to stay right here. So if you have a bicycle that you're selling for $200, that's not the kind of announcement we're talking about. Unless it's senior setup, and maybe it has all kinds of gadgets on it that you're trying to give away. That's a great announcement. But if you have an event, an activity, if you need somebody to collaborate with something that's going on with you or your organization that's senior focused, come on up. So anybody want to make the stand up here? All right, come on up. Start off. Just go. All right. I just wanted to take a quick moment to introduce myself, Joanne Wiley. One thing I wanted to say, if you are working with seniors and they do need to transition to an independent living, nursing and living, I can help facilitate it. So they don't have cash in their home or they can update their home because we're smokers for 30 years. I work with a lot of contractors that actually do the work and then they get paid. There's no leave in the house. Real benefit for our seniors, maybe cash poor but house rich. That's it. Thank you.
What about here?
Yep.
I'm Mike Staffy. I'm the owner of Silverlink Consulting. Silverlink does a lot of community outreach and events. Here, for 2026, actually, we're going to be the title sponsor for the Shepherd Center of Orange Park. They do an annual gala. I emceed it last year. If you come to it, I get to MC it again. That's in May, but part of the gala is honoring older adults that are 60 years or older, and you can nominate them. So if they do volunteer work, for example, one of the gentlemen who won Man of the Year last year, volunteers something like 6,000 hours a year at Clay County Bank. He's there all the time. So if you have clients, families, caregivers that are 60 years and older, you can go to teamscoop.org and there's a nomination form online. So we're really looking for lots of nominations. The cutoff for that is January 31st of 2026. So if you have somebody you can nominate, all of the guidelines are right there. You can fill that out and then we'll bring them and invite them to the gala in May and give them some honors. If any of the businesses want to sponsor, we're still collecting sponsorships too. And if you're not familiar with the Shepherd Center, a couple of us I see in the room teach there on a regular basis. It's essentially a active adult senior center. where they do classes of all kinds. So I teach a weightlifting class there for about 16 ladies. Lindsay, you teach a iPhone class? Yeah. Yeah. So yeah, I used to teach the iPhone class 5 years ago. So it's a great organization if you have been involved in it yet. But accepting nominations.
Excellent. Thank you so much. Carol, please.
I'm going to do a quick plug for my book, which is something to help with aging in place. And the reason I'm doing it is because I'm only one person. I can't help everybody else in every other house. So literally go step by step. Like, I'm in the bedroom. What do I see? What are the problems? What are the DIY things that you need to be doing? And what I'm asking is that, libraries basically look at Amazon reviews to decide if they're going to add it to their collection. Because what I really want is for people who don't have the money to buy a book, just go to the library and get the information. So my book is dedicated to caregivers so that they have equal access to information to help their loved ones. And spreading that news would be great. Thank you.
And if you don't want to take that back in your car, carry it all the way down there at the end, if you want to give it away as a door prize later, you are welcome. Fine too.
Hi, I'm Christy Ayala with Florida Blue. I just wanted to mention that we have 2 retail centers in Jacksonville, one at the town center and one in North Jacks. And we offer tons of free fitness classes for seniors. That our calendar's online. You can look it up. We've got sit classes, Tai Chi. It's all free and open in the center. We do healthy cooking classes, diabetes prevention. We do health assessments there. So if anybody's interested, feel free to ask or look it up online on floridablue.com.
Sure.
Oh, there you go.
This is my own line over there. Good morning, everybody. My name is Anna O'Toole. I'm Utility Assistant Manager at JEA. Just wanted to make a quick plug for our Senior Day, which is coming up next week, Wednesday, November 19th, from 9 a.m. to 2 p.m. We do it every month, the third Wednesday of every month, and it's essentially a resource fair for our seniors, and it's open to the public. Anybody can attend. And if you want to come and see what it's like, you're welcome to attend. But our goal is to connect our senior customers and seniors in our community to different local resources. We have some folks in the room that attend, including Ms. Yates from City of Jacksonville Senior Services. ElderSource is there. Just a lot of different nonprofits in our community. In addition to those 2, we have LIFT, who is there, JTA. We have different programs from JEA that we have resource tables there, including our efficiency assessments, and we'll have somebody there to talk about the JEA app. There's just a number of different organizations that are there to help provide information and resources to our seniors. So if anybody is interested in attending, please feel free to do so or share the opportunity with any seniors that you work with. Well, and we validate.
You should have led with that. You would have had to, more interest. So.
And so it's the third Wednesday of every month. So it's next month.
I put these on your table. This is a better age survey. This is something that we're doing. It is a self-assessment for older adults. We're really encouraging older adults to take it. We get the results back, and it helps ElderSource help know what the needs are in the community and what we should have on. But it's great for older adults and caregivers. It takes about 7 to 10 minutes to ask you questions. How do you feel about your balance? How are you sleeping? You had an emergency. Do you feel like you could have somebody you could talk to? And after the older adult completes the survey, they'll get the results immediately. All right, looks like you're concerned about your balance. Here are some ways that you can work on it. Looks like you're concerned about your sleep. Here's how you can help with that. Looks like you're concerned about your financial security. Here's how you can help with that. So that's what this is for, the Better Age Survey. And you have a QR code. And like I said, we get the results back. At least it helps us. They're like, what are older adults struggling with? What do we need to focus on? What do we need to help them with? So if you could just help us share our Better Age Survey, I would appreciate it. Thank you.
Thank you.
Good morning. My name is Jennifer Smith. I'm with Northeast Florida AHEC. You guys just heard from my executive director, Tonya. I just wanted to give you guys a little bit more information about our trainings that are coming up. We offer evidence-based programs in our 7-county service area, and we have the ability to certify the trainers for those programs
So we have some trainings coming up. So we have a self-management program training coming up in January and February, a matter of balance program training in March, and a diabetes empowerment education program training. So these are contract opportunities for folks in our 7-county service area who are passionate about working with seniors and are maybe passionate about the topics of each of those programs. So those are free to attend, and then it's an opportunity to contract with us. So if anybody has any questions, you can definitely email me. I have some flyers that I'll have at the back table back here, so you guys can come and see.
And Jen, if you want to pass them on at the table.
Okay, yeah, absolutely.
Yeah.
I'll
All right.
grab the camera.
One last one, come on up. Great to see you, by the way.
Good morning, good morning. I'm keeping brief. I'm probably on the verge of throwing us off track. So, but my presentation, I'm going to get into here for 5 minutes. It's a faith-based financial services company, but I'm not pitching anything to you all today. We have a free budget coaching program called Money Canvas that may be of benefit to your seniors. It's a free 3-part virtual program, so anybody who benefits can do it. They have it in English and Spanish. We have dedicated staff that work hours and all classes typical work hours and on weekends. So I did it myself when I covered it, and what they do is a 3-part. They have 3 1-hour sessions where you examine your bills, see where you have a little bit of wiggle room, and see where you can start moving from there. So it's not quite a full, financial advice, with an advisor, but it's a great resource for people that maybe may not want to meet with an advisor. And there's no pitch involved. There's no sales involved. It's free of charge. So feel free to grab my card or Google Thriving Money Canvas to share that with us.
Stacia, thank you so much. So for anybody who had a chance to make an announcement, if you do have cards or anything like that, or if somebody made an announcement and you'd like more information, make sure that you just, get them for a minute or so before you head out today. I know that they would appreciate that. So excellent. Thank you so much for being willing to share that. Herb, anything on chat that needs to be added on?
Got it.
Okay. Got it. So we are moving into our program. We're really just thrilled to have Emily with us today because Emily is in the middle, as you most of you know, Blue Cross, et cetera. We are in the middle of open enrollment. So to get her on the schedule to say what would be helpful for this group to know, and she's doing these presentations all over the place. So we were happy that we could lock her in for this morning to join us to do this for the meeting. So she is with Shine, who is a program at ElderSource, but she's actually an ElderSource employee, as is Gabby. And we're really thrilled that she is with us today. So Emily, you see that he's kept me in line that I'm here. So if it's easier for you, you can sit if you think that that's a better option for you, or you can stand, whatever you would like to do. And then the speaker's here that the Zoom folks are going to hear. So if you want to, Gabby, you can move the slides over to her side. And I'm going to get out of your way. Absolutely. Yep, right there. That's the typical.
Thanks. Well, while Gabby is Gabbying that, hi, my name is Emily. That's a trademark term, Gabbying that. I am with Shine. Shine stands for Serving Health Insurance Needs of Elders. Has anybody heard of Shine before? Wonderful. That's fantastic. And while we're getting that up, Shine does several presentations each month, but during open enrollment, those numbers go way up. So in October, we did 24 presentations as a team. And November, our grant benchmark is 14. So if any of you guys decide that you like this presentation, you want to have me come talk to your group about it, feel free to flag me down after and we can put something on the schedule.
I saw it. It's on its way.
No worries.
Flag.
Sorry. No, that's all right. Look,
How long have you been with ElderSource?
I have been with ElderSource since May of last year, and I actually started with Gabby on the communications team over the Caregiver Coalition. So I know a lot of faces in here, and I see a lot of new people, which is wonderful. And thank you guys so much for coming. All right. So Medicare Open Enrollment. Let me know if I'm also a mover. So,
Okay.
All right. So Shine is a grant-funded program that was started in 1990. We get our funding from the Florida Department of Elder Affairs, which get the funding from Shine from ACL, Administration for Community. Now, the DOA, or Department of Elder Affairs vision, is for all Floridians to live well and to age well. And the Shine mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed health choices. Now, I'm not going to be reading the slides the whole time we do this presentation. There are a few things that are imperative that this is another one, our disclaimer. So Shine is a free program offered by the Florida Department of Elder Affairs in partnership with your local area agency on aging. That's ElderSource. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. Shine services are free, unbiased, and confidential. Shine is not affiliated with and does not endorse any insurance company or product. So the Area Agency on Aging, you guys heard from Gabby. You guys know that ElderSource, the building that you're in, is the Area Agency on Aging for North Florida. But what does that really mean? So ElderSource covers all the way up from Nassau, all the way down to Volusia, which means there are Shine presentations all the way up from Nassau, all the way down to Volusia. And I talk about things, our Shine counselors talk about things like open enrollment. You saw in my title, Shine and SMP specialist. SMP stands for Senior Medicare Patrol, and I'll dive into that in a little bit. We also talk about general ElderSource information, the services provided that some of you may have learned about at the Luminary Luncheon if you were there. So here are some things that our Shine counselors can help you with specifically. We've got Original Medicare, Medicare Advantage plans, Medicare prescription drug coverage or a Part D plan, Medicare supplement insurance, Medigap, that's the other name for that. Then we have our financial assistance program, Extra Help, and the Medicare Savings Program. Now, our Shine counselors are able to help clients fill these forms out. Say we have a client that doesn't understand what the forms are, maybe they're lost. Our Shine counselors can sit down, they can call them, they can do video calls, or they can sit down with them face-to-face in a public setting. When I say public setting, I mean somewhere where they can both meet, but still private. Does everyone understand what I mean? You know, the study room in a library, something like that. And they can help them fill out these forms. Then we have long-term care planning. Now, this is something that our ElderSource helpline does more of, but Shine counselors are still able to help. Then we have the SMP section. And SMP covers Medicare complaints and appeals, as well as Medicare fraud, waste, and abuse. So when I'm not giving presentations, I'm working fraud cases. The open enrollment period. It can also be referred to as the already enrolled period. When you're on Medicare, or if you're dipping your toes into Medicare, there are several enrollment periods. You may hear about special enrollment periods when you're moving from service area to service area. And you guys may hear me saying things like you being on Medicare. That's because I usually give these presentations to clients that are already on Medicare in our senior centers. So please don't be offended. This is an opportunity to change coverage, add coverage with your Advantage plan, your Part D. Oops. Sorry about that. And it lasts all the way from October 15th to December 7th every year. These changes go into effect on January 1st. If you have any questions regarding these things, or if your clients have any questions, see, I'm catching on. If your clients have any questions regarding these things, Shine is able to help. So Shine is not selling anything. Shine is not pushing anything. Shine is just here to help your clients keep their money in their pockets. The annual notice of change. Now,
this is usually where I say, has everyone received their annual notice of change? Anyway, you should receive it by September 30th. This covers changes on things like your premiums, your formulary, as well as deductible, copay. So pretty much the financial changes that are going into effect on your plan, and it gives you a chance to change if you're interested. So you guys out there in the world of seniors may hear people say, oh my gosh, I've had this plan for 10 years and I love this plan and I'm never changing this plan. It's my plan for the rest of my life. Does that sound familiar to anybody? Yeah, I see some nodding. Did we fall asleep? Maybe a little. And I always let them know that it's important for them to check their annual notice of change, because even if they love their plan and they've had this plan for 10 years and it's been their favorite plan ever, they need to read their annual notice of change, because maybe they've been taking a medication and maybe this year their plan doesn't cover that medication. If they don't check their annual notice of change because they love that plan, they might have to pay out of pocket for that medication. And so that is why that reminder is there. Plan marketing. These are the unflattering commercials, the constant mail. It starts on October 1st and it goes. And these are things, this is the part of the presentation where I remind all of our seniors they are valuable. And I'm going to remind every single person in this room, you are valuable. So even though it may not be in relation to Medicare plan marketing for you guys, even if it is, you are valuable, okay? So if you are getting all of these scam calls, if you're getting calls on your phone and you don't know the number, send them the voicemail, okay? You don't owe them an answer. If they want to speak to you, they will leave you a message. You can listen to the message and decide if you want to speak to them. And that is the reminder that our seniors need. It's important to take time considering your options. And what the slide means by that is sometimes there are scam calls specifically regarding Medicare plans. And I'm not talking about people who are selling the genuine plans, people who genuinely work for the companies. I'm not talking about you guys. I'm talking about the people who call from those unknown numbers. They say, I have a great deal for you. You're not going to pay anything. All you got to do is give me your social. That's what I'm talking about. If there's something that's too good to be true, it probably is. And it's important to take time to consider your options, because those calls, most often, the people who are getting them here, no, you have to make the decision right now. You just got to give me your social right now. This deal's only going to last till the end of the phone call. It's okay to hang up. Understanding the Medicare path. Now, I always call Medicare alphabet soup. There is part A, part B, there's C, part D, alphabet soup. I'm going to give you guys my personal cheat code for remembering the parts. You don't have to use it. If you want to use it, that'd be great. So we have original Medicare on the left here. Part A covers the hospital because the ambulance takes you to the hospital. Part B is medical coverage, which covers your doctor's visits because you better go to the doctor. Then we have our Medigap, which bridges the gap. So Medicare is an 80-20 plan, right? Medicare pays 80%. The beneficiary pays 20%. Now, Medigap decides, hey, whoa, 20% is way too much.
So these beneficiaries pay an extra premium, which we call premium subscription. I tell our seniors this because it's important that they know the difference between premium, deductible, copay, all of this jargon that's in the insurance industry. Because once you understand the word, it makes it a lot less intimidating. So Medigap bridges the gap. Then we have Part D. D as in drugs. That's the only letter that makes sense. So on the right, we have our Medicare Advantage plan. It still has Part A and B. Usually Medicare Advantage plans also come with Part D included. Now, it's important to compare your out-of-pocket costs, your drug formularies, and all of these things when you're making the decision between Advantage and Original. And I'm going to dive into that. During open enrollment, you can make changes, like changing from your Advantage to Original. Now, you may hear people say that you can't change from an Advantage plan back to an Original, and I'll dive into that a little bit too. You can also change from Original to Advantage during OEP. You can add or drop prescription drug coverage. As previously mentioned, open enrollment period is pretty much the time to pick and choose if you're already enrolled. Now, please be patient. These are a lot of slides. We have changing your drug plan. It's important to ask yourself if all of your drugs are covered, as well as if there are any copay, co-insurance for the drug. As previously mentioned, see, I get excited about these things and then I talk about it before it's slide. Switching from Original to Advantage. It's important to compare your out-of-pocket expenses, but there are also a few steps, right? This is the part where I'm the mover. So, Original Medicare, all you have to do is ask, does my doctor accept Medicare, right? With an Advantage plan, you have at least 2 steps, okay? You have, does my doctor accept Medicare? Is my doctor in my network? And if you're doing an HMO plan and you want to see a specialist, you have, does my doctor accept Medicare? Is my doctor in my network? See my primary care doctor for them to make a referral. So if you have a chronic condition, or if you see specialists a lot, if you see doctors a lot, it's important to compare which plan that you need. It's important to compare the out-of-pocket costs for your copays, so how much you pay when you go to the doctor each time. And then switching from Advantage back to Original. Has anybody in the room heard you can't do that? Yep, you've heard that. Do you know why?
Because I don't want to do.
That's a good answer. That's a really good answer. Because they don't want you to. I'm not allowed to say that while I'm up here. But all it says on the screen is compare your out-of-pocket costs. When you turn 65 and you sign up for Medicare, nobody asks you any question about chronic condition if you take an expensive medication, because you have guaranteed rights to Medicare, right? When you change to an Advantage plan and you stick with this plan for a year, they say, well, they don't want their guaranteed rights anymore. So when you go to switch back, they assign an underwriter to your case. I saw somebody look up. They heard underwriter. They assign a financial expert to your medical history. They go through your medical history. They say, oh, heart disease. They say type 2 diabetes. They say this, that, the other medication. And they assign you your own Part B premium.
which is different from the Part B premiums that other beneficiaries will pay that year. And they're saying, no, 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 we're not making any discrimination. We're not saying you can't have Medicare. You can still have original Medicare, but you're going to pay this one because we have to keep it fair for everybody else. So that is what compare your out-of-pocket expenses means on this slide. And it's a heavy topic. It is something that Shine can help you with. We recently helped a 99-year-old gentleman change from an Advantage plan back to original. It can be done. I understand that it's a heavy topic, but knowledge is power. And it is important to know things. When you're comparing your Advantage plans, I mentioned previously the number of steps, but there's also the cost per visit. There's also the cost per month. So typically a PPO would have a higher premium than an HMO with more doctors in network, or you don't have to go to your primary care every time you want to see a specialist. It's also important to ask if your drugs are covered. And you'll notice that this is on just about every slide because this is something that is so important. Are the prescriptions covered? Because if your prescriptions are not covered, you can have the best plan in the world and still pay so much out of pocket. I hear some yeps. So that is why we have this entire slide on with versus without drug coverage. And you know that it says a penalty may apply. And that is because there are penalties for signing up for Part B, as in but better go to the doctor, and Part D, as in drugs, late. These are things that the Shine counselors are able to answer more questions on. Selecting your Medicare coverage. So there's enrolling, disenrolling, filing complaints, Medicare fraud, all of these things you can call Shine. You can go to Medicare.gov, you can call Medicare, you can call the number on the back of your plan card. And please don't get me wrong, I am not disparaging your plans. I am not disparaging the Advantage plans. I'm not, talking badly about original Medicare. I'm just here to give information. And when I'm at the senior centers, I always compare, you might laugh, I always compare choosing a Medicare plan like shopping for shoes. And Shine counselors, we can't help you if we don't know some information. Just like someone can't buy you a pair of shoes if they don't know your size, right? If they don't know where you're going. You need some information. So the Shine counselors are going to ask you a few questions and they might seem personal. That's because we need the background information in order to make proper decisions when looking things up and doing the research, because we want to make sure that plan fits you like your dream shoe. I mentioned before the financial assistance programs. These are things that the Shine counselor can help with. And now we have SMP. So Senior Medicare Patrol, or SMP, is a specific grant that goes over, or that covers Medicare fraud, abuse, and waste, as well as Medicare complaints. I mentioned that when I'm not giving presentations or planning presentations, I work Medicare fraud case. So this is funded by the Administration for Community Living. The three areas that we focus on are education, recruiting volunteers, and assisting with beneficiary complaints. So what happens
during our usual complaint system is the individual will either submit something to DOEA, Department of Elder Affairs, or we'll call the ElderSource helpline and let them know. That will get passed on to us. We will call the beneficiary, get the information, begin what we call a complex interaction case. So we'll start doing the research. And once we have built a solid case, we forward this directly to the Office of the Inspector General. So this is something that beneficiaries do not have to worry about. This is something that has weighed on them heavily, that once they pass it to us, we will do the work and communicate with them as it goes on. We'll give them updates, we'll ask them questions, we'll ask them for documentation, we will ask them to supply the things that they can, and we pass it on. Now, the difference between Medicare fraud and Medicare abuse is intent. So Medicare fraud is someone who is intentionally spending the Medicare fund. Medicare abuse is when someone gets a billing code wrong, is when mistakes are made, someone accidentally bills it twice, those type things. Now, there are 3 steps. You know, I do a lot of steps during this presentation, right? 3 steps to prevent healthcare fraud. We have prevent, detect, and report. So keeping your Medicare card, Medicare numbers, and your other personal health or personal identifying information numbers secret and safe. That's step 1. Keeping your social security card in a safe location, keeping your Medicare card in a safe location. That's part of preventing. Detecting is checking the Medicare summary notice or the explanation of benefit. That is the thing that you get in the mail that says this is not a bill. It actually kind of is a bill. It's a bill to your Medicare fund. It's a bill to your Medicare plan. And it outlines, just like a credit card statement, what you have charged to Medicare. So maybe you didn't go see a genetic doctor in New Jersey last week, right? That would be something that might be worth asking a question about. That's something you could call Shine about. And report. So if you see something unusual, important to say something. $60 billion. That's how much is spent out of the Medicare fund every year. It's an estimation of how much is spent out of the Medicare fund every year that shouldn't be. And so sometimes during these presentations, people will say, well, it's not billing me, so I'm just going to toss it in the trash. Okay. But what about your grandkids? Because this is money that's coming out of the fund for Medicare that could be going towards your grandkids. So I always tell the people who say it's not billing them, so it's not worth it. Do it for your grandkids. And then opportunities for fraud and abuse. If the person has if an unwanted person has the card, has access to the Medicare card, so maybe somebody used to take care of them, they don't get along with them anymore, they have their Medicare information, things like that. If the card has is sent to the wrong address, like for example, when I just moved into my new house, I checked our mail for the first time and there was a Humana card in my mailbox. So I turned that into the post office. Those type of things. Detecting. Going over the Medicare summary notice. And then reporting these things. So here are the red flags on the Medicare summary notice. also known as the explanation of benefits if the individual is on an Advantage plan. Is this a provider that you know? Do you see services appearing twice when they shouldn't? Another example of Medicare fraud is the individual walks out of their home and they see a box just chilling on the doorstep. They open it and it's got like 8 knee braces in it. First of all, they're not a spider. They don't have 8 knees, right? Something's a little wrong there. So in that situation, it's best for the individual to keep the box because the information that we can get from the return address, from the packing slip, is amazing. Our volunteers are so impressive, to be very honest. I can't wait to learn all of it. There's a lot of buttons. So reporting your Medicare fraud if something is unusual. Here are some other numbers that you can call. There's Medicare, there's the Federal Trade Commission, but they trust Shine counselors who have been background checked and who have been given classes and exams. They trust us with what we call a backdoor. So we are able to get in contact with someone from the Medicare office within 5 minutes. So you give us a call, we give them a call, a little bit faster than waiting on hold, just a little bit. Does anyone have any questions? Yes.
You had a slide, you don't have to necessarily go back to it, but about the 2 things that people can get financial assistance with.
Yes.
Can you elaborate a little bit about that and what that looks like and how that helps?
Yeah, absolutely. So those are actually the reason that I chose to accept this role because like I said, I started this position, I started with ElderSource on the communications department and my grandparents were having some trouble with their Medicare. I recommended that they call Shine because I worked in the ElderSource office. And I promise I'm not making this about me, it's just a little anecdote about the financial assistance program. And my grandparents called Shine. The Shine counselor helped them fill out a financial assistance form. They made $12 too much. $12. So at first it was declined. The Shine counselor went back. I don't know what they did, but apparently there was a $20 buffer on the acceptance that the Shine counselor knew about that we didn't know about. And so because of that Shine counselor, my grandparents were able to receive financial assistance program from Medicare. And so I chose this role because I wanted to go to the senior centers. I wanted to go to the libraries, to the places where our seniors meet. And I wanted to be able to tell them that these resources are available. So the numbers for the financial assistance programs update every 6 months. This is not something that you'll find published that I know of. We have them as Shine counselors. To be very honest, I'm not sure where we get them. I'm still learning. I've been in this role for about 6 months, so I still have a lot to learn, especially those of you who know anything about Medicare know that it's always changing. But the numbers are updated every 6 months. The people can call the Shine counselors. They can help them fill out the information, tell them what to put, and they submit the benefits, or excuse me, they submit the application. The Shine counselor can submit the application. And it really makes a difference. It really makes a difference, yes.
So, and Emily, so did they get help covering their Medicare costs? Is that how that benefited them? And it's the same with drugs. I know that there's 2. Is it the same with drugs, that there's programs to help with that?
So my grandparents no longer had to pay their. Yes.
Oh, I was just gonna follow up. I always told you this. I did a client like 2-3 years ago, and the woman I spoke to, she saved so much money on her premiums. I was talking to her. She's like, thank you guys so much. Like, I don't have to go to food banks anymore. Like, I can afford groceries. with stories like that, those are real people that I'm like,
Yes.
Again, so first off, really great presentation. Also, thank you for sharing your passion with us too. And I have a question. Let's say perhaps let's just pretend that I'm 55. That great presentation really educating me about it. How do you advise someone that they 64 about to turn 65? What's next? Like, which area do I like? How do I get signed up for? So what kind of messaging are you delivering? Here we go.
Absolutely. That's an excellent question. So, when I go to these presentations, I take a sign-in sheet with me and I pass it around to every single person. I start on one side, pass it, have them pass it. And I start my presentation off with, hello, ladies and gentlemen, there's a sign-in sheet going around. And if everyone could please write their name on this sign-in sheet, that would be very helpful because it lets the people who are funding our grant know that we're talking to real people, that I'm speaking to real people. And if you decide that you would like some assistance, if you would like a Shine counselor to call you, please write your name and your phone number or your email, the best way to contact you, on the sign-in sheet. And I personally refer them to the counselors. So after the sign-in sheet goes around, I collect it after my presentation. And then after I pack up and go back to the office, I submit the referrals to Ms. Kim. And Ms. Kim, who knows our volunteers so very well, actually makes note of which person goes to which counselor. So if there's somebody who only speaks Spanish, I'll make a note of that sign-in sheet and she'll give them to Ms. Carrie, who speaks Spanish. Or if the person is very passionate about something, she'll put them with a more patient volunteer. Absolutely.
Good answer.
Thank you. Actually, good. Thank you.
We got about 2 more minutes, so please continue on.
Absolutely.
Medicare, we're gonna stop calling replacement plans Advantage. It's a misnomer.
You know,
Who's it an advantage?
that's a very good question. I don't know the answer to that. I gave a different flavor of my presentation today because of my audience. But I typically refer to Advantage plans when I give the presentation. I say that they're an advantage to the people who use them, who need them, because they do have a place. Original Medicare is accepted by more doctors, but Advantage plans have a place as well because sometimes they provide additional benefits to their beneficiary. Things like dental
But it's not
and
always an
vision.
advantage.
No, it is not always an advantage.
an advantage plan.
And that's why I made the comparison to shoes. There's a different shoe size and a different shoe fit to every single person. Yes,
Again, to Colin's point, great presentation.
thank you. Absolutely.
2 questions for you. You get a lot
Absolutely.
that you have a Shine counselor that's
We have a Shine counselor that is very passionate about veterans. She's not specifically designated for veterans, but she is very passionate about veterans and very experienced in TRICARE. Her name is Janet. She's wonderful, just like all of our volunteers. But you noticed in our disclaimer at the very beginning, it's Medicare, Medicaid, and other insurances. That's because, you know, the work union insurances and things like that, we help with those as well as TRICARE. And so individuals, beneficiaries can give us a call on how their TRICARE may interact with their Medicare, if they should choose an Advantage plan or if they should choose Original Medicare when they're first signing up, and how that might interact with TRICARE or TRICARE for life. So that's why I make the shoe comparison, because I guarantee you every single one of us are wearing different shoes, just like every single beneficiary has a slightly different edge to their plan. You know what I mean?
And,
Absolutely.
we have 2 more questions and then we'll we'll wrap you up, but you can hang, and you're welcome to hang. Carol, and then right here.
So I wanted to ask you if you talked about Medicare versus Advantage. That is a huge problem where getting people are leaving $2,500 worth of money on the table, not thinking I'm saving money doing a Medicare Advantage, and it's only available to those in Medicare.
I am not familiar with that. Like I said, I'm new to Shine, so I have so much to learn about Medicare, but I would like to hear more about that
I
after
have
I'm done.
let people from Advantage.
Oh, yeah.
Social Medicare Advantage.
Yeah, 100%. It needs to be, but they're gonna expand that. So you're visiting out and you're not.
And one last question here. Did you have a question?
Advantage Medicare. That's what we need to know.
Yes,
For example.
yes.
So we can. We have. California for the vacation or something. I had to.
I'm not 100% sure, to be very honest, but I can find the answer to that and let you know before you leave today.
Thank you.
Absolutely.
Okay. So, first of all, huge round of applause for Emily. Shannon, do you mind, can you, Gabby, put me back on mine, but, Gabby needs you more importantly than I do.
So if anybody has anything they'd like to
Yeah. And, if we find out a more elaborate answer to what Carol asked, if whoever that is can get that to us, we send out next week, a link to everybody who's registered with the recording. And we can include that as an attachment. And same with AHEC. If you have something, AHEC, if you want to give us a brochure that's electronic, we'll send that out as a thank you for being our breakfast sponsor. So with that, oh, there we go. So with that, can you go back one? Oh, I can go back one slide. I'm back in power, aren't I? All right. So thank you to the breakfast sponsor. It should say AHEC there, but again, for some reason, that laptop does not let things happen. These are just an example of all the different things that are already recorded on the YouTube channel. So you can see all these different things, mental health resources, senior nutrition, and the like resources. We've had some fantastic speakers here that have taken time out of their full busy day to come and be part of this program and share their expertise. So you want to tap these, you can even just skip fast forward, which you would be skipping past me. My feelings won't be hurt. It happens all the time in my personal life. But you can just skip right to where the program is, and the program is usually about 30 minutes, and then here's just the program part. So awesome stuff. In fact, the medical marijuana one, I think we had it in this room. I walked out of there with a completely different perspective of the benefit of medical marijuana and how it works and all those kinds of things. And when that day comes for me, I will be signing up for that. Also to the senior roundtable meetings, I will get a driver. So you have also send that list out. In fact, we will. We've got the list. We'll include it in the attachment for next week. And AHEC, huge round of applause again for AHEC.